all my friends. This is awesome. So this talk is called Aspen or Bust. So luckily I do pediatric orthopedics. So that means that we have the coolest patients and hopefully you have the coolest parents too. So my disclosures are here, but do not pertain to this talk. So here's a 9-year-old and he presented to me. He had been in our institution for a while. He was a twin. He was born at 32 weeks and unfortunately he developed a pretty nasty infection and it affected his femurs, it affected his humerus. And, Staph aureus infections are pretty serious. So if, residents are listening, this is the one thing you need to take away from this slide. Staph aureus is bad. If you see some swelling on one part of an infant's body, you look for it in all parts of the infant's body. And you need to react quickly. Because if that Staph aureus gets into that blood supply, those loops of metaphyseal vessels can move very slowly. And so you can have an abscess that quickly goes into your joint. And then you get increased pressure and you release all those reactive oxygen species and it can become very problematic and destroy that articular cartilage and make great problems for us in the future. But it's really just, we would like to try to get on these quickly. So this child ended up having bilateral hip infections. He had a gluteal infection. He had a humerus infection. He was actually treated in a Pavlik for the hips, which was helpful. And so when he presents to me, he has a short humerus. He has a femoral shortening. He's in a little bit of valgus. He's really, he's a great guy in ballet and he's an active skier. I actually met him on the ski slopes once. And you can already see his valgus deformity in his leg.